All right, so I think we can go ahead and get started. I'd like to welcome everybody to the ABRF monthly administration town hall, one of a number of town halls that ABRF puts on throughout the time when we can have these virtual town halls and discuss everything from uh, specifics around scientific disciplines to general management and leadership and admin issues such as the leadership in time of crisis presentation we're going to have today. Before we get started, Andrew, do you have any announcements or anything about from the admin town hall perspective at this point, or should we jump right in?
No major announcements, Andy. Just thanks everybody for joining. And if you have ideas for future town halls, we'd love to have them. We have some percolating, but feel free to engage, and we'd love to hear from you if you have specific ideas you'd like to hear from.
Great. Thank you. I'd like to welcome those folks from CTLS, our partners and friends from Europe who are attending, and I believe there are a few of our colleagues attending from Africa as well. So welcome, and know that you're always welcome to join these town halls. At this point, they're open to anybody and everybody at no cost, and we really enjoy being able to interact with everyone in this way. So with that, I'd like to again thank everybody for joining, and I'd like to welcome my colleague at Oregon Health and Science University, Katie Fauner. She's the Senior Organizational Development Consultant at OHSU, and she brings experience in organizational effectiveness, and holds a PhD in organizational communication from Northwestern University. I'm really pleased that she was willing to do this presentation for us. I think it's obviously appropriate for all kinds of reasons for all of us dealing with this worldwide pandemic that affects us all. And in addition, a number of us, OHSU in particular, have dealt with our own little sub-crises as well. OHSU just recently had to deal with not only the COVID pandemic that is underlying all of our activities, but also wildfires in the region which shut down and displaced a lot of people throughout the region. The entire city was blanketed by pretty thick smoke, and so we were dealing with two things at once. And I know that's happening throughout the world in various ways. So this is a great opportunity for us to talk about how we deal with these kinds of things and how we can optimize our effectiveness together as employees and as leaders throughout our various communities. So Katie, I'd like to turn it over to you now, and maybe you can embellish a little bit on what was my very small introduction of your work, and then jump right into it.
Sure. Hi, everyone. Thank you so much for inviting me to be a part of your meeting today. And actually, just a little housekeeping before we get started. If you wouldn't mind putting yourself on mute if you aren't already. I noticed there's a handful of folks who aren't, just to eliminate background noise. That would be really helpful. So I'm Katie Fauner. As Andy mentioned, I work also at Oregon Health and Science University, OHSU, in Portland, Oregon. My role is as an organizational development consultant. And what I'm going to present today is sort of a modified version of a training that we've been offering at OHSU for leaders that we initiated at the start of the COVID crisis. And of course, now this feels like quite a drawn out crisis. So we're kind of going in waves, but let's kind of keep that in mind as we walk through the topic today. So today I'm going.
Can I jump in real quick?
Oh, please,
I just
yes.
mentioned that. Sorry about that. I forgot to mention that in the chat you can place questions as we go through, and we'll have plenty of a bit of time to answer those questions afterwards. Those questions that we don't get to, we can continue to try and answer them and post them later on the website. Sorry about that.
Thank you. Yeah, that's great. I was going to say the same. So today I'm going to be walking through a few things, but we'll be encouraging you, if you'd like, to also comment and reflect in the chat as we move forward, just so that you can apply in real time what I'm presenting to your experiences. So today I'm going to talk about a couple things. The first is how leaders often respond to a crisis, sort of what are our instincts in a crisis. And then I'll focus on what are some best practices for leaders in leadership in a crisis. And then the bulk of the conversation today will be around a model that comes out of neuroscience that will help you really focus on 5 things that you can really hone in on for your teams in times of crisis. So again, have your chat box up if you can, and I'll be asking you to contribute throughout if you're willing, just as a means of engagement. So in a crisis, we often rely on our well-honed instincts and on our leadership training if we've had that. And in general, that serves us really well in our day-to-day. But in times of crisis, those instincts can actually work against us or not be as effective in the moment. So for example, often our instincts as leaders are to wait for additional information, to seek out additional feedback, to gather all the data, and to not act until we really feel like we have a whole handle on things that are going on. And that is not always helpful in a crisis, right? We can't always just wait to systematically evaluate all of the data out there before taking action. Another instinct we have is to downplay or withhold bad news. So sometimes this comes from a really good intention. We don't want to spark concern or create too much additional worry, or even draw attention to a challenge that we don't quite understand yet. But this sort of instinct can lead us to holding information too tightly to the vest and not really sharing candidly or in a timely way. So that instinct does not necessarily serve leaders well in a crisis. The third instinct we have is to sort of double down and just explain the actions that we've committed to rather than being flexible. And this commitment to a plan is, in general, a great thing that leaders have, right? To set a plan and stick to it. But of course, in times of crisis, there's so much uncertainty that sticking to the plan and being kind of rigid in that adherence to the plan will not serve us well as leaders. So what should leaders do in a time of crisis? There's been a lot of research on this, so I've just captured a couple things on this slide, and then we'll delve into some more specifics as we go on. But in general, one of the most important things that leaders can do in a time of crisis is communicate empathy and compassion. And there's a reason that this is first on the slide. It's crucial, and it's also very easy to overlook, because often in a crisis, we're in a rush, we're in a hurry, we're trying to act expediently, and that can sometimes, that speed and frenzy can kind of get in our way of slowing down to think about how we are doing, how our teams are doing, and communicating that empathy and compassion. So it's really important to acknowledge people's fears, acknowledge what people are dealing with, the stress and uncertainty that people are dealing with, and what that brings up for people. And to communicate not only compassion and understanding for that, but some resolve and resilience, and committing toward getting through that together. We have the chief executive of research at OHSU sends out a really amazing virtual newsletter update, and his tone and the content of that has really done an amazing job at communicating empathy and compassion for what people are dealing with. And that has made a really good difference. So also, as a leader, take care of your own emotional needs. Be empathetic toward yourself, because working through a crisis can be quite stressful. So just be aware of that as well. Acting with urgency is crucial as well in times of crisis. So like as a flip side of what was presented on the previous slide, rather than waiting and ensuring that you have every single piece of information that you might want, understand that there is a sense of urgency and decisions need to happen quickly. So this is a time to be really frank with people about, listen, this is a time where we don't have all the information. We need to take some action. This is going to be a little bit of experimentation and learning. We're going to make a decision based on what we know today. We're going to go for it, but then we may need to be flexible and change or adapt as more information comes to light. So even just saying that out loud and being pretty candid about that can be really helpful. And that leads into the next bullet point around being transparent, making sure that people have continued updates, timely information, and that there's some candid sharing so that people really feel in the know and aren't just sort of making up their own stories or their assumptions about what's going on and what the action steps are. And then the final one is rallying people around a common mission. People in a crisis crave having a sense of purpose and a role toward that common mission. So that idea of we're in this together, we're working on this together, and we will get through this, and we are all kind of pointing in the same direction can be really powerful in times of crisis. So just looking at these, I encourage you to think about, and you're welcome to contribute in the chat if you'd like, just about how you've seen these 4 elements of leadership show up either at the national leadership level or the local leadership level, or even with your organizational leaders. You know, what have you seen done well? And what have you seen maybe not done so well or missing from their leadership? So just do a little bit of reflection on that as you think about why and how these things are important. And I'll just call out one example. One leader who has been really recognized for her leadership during the coronavirus pandemic is Jacinda Ardern, who is the Prime Minister of New Zealand. She has really demonstrated each of these things quite well in her response in the way that she's led in the time of crisis. So the things that I just walked through in terms of best practices for leadership in a crisis, you know, why are those important? They are important because they serve employees or people's social needs. And there's been a lot of research about social needs and why they're important coming out of neuroscience research. And what the research shows is that when social needs are not being met, like you see on this slide where there's social pain, so when your social needs are either not being met or are threatened, people actually experience similar responses in their brain as they do when they experience physical pain. So this really heightens the attention that we need to show and towards serving people's social needs, because when those things are being threatened, it really triggers a response that's similar to experiencing physical pain. Not only that, but when people are experiencing that social pain, it can lead to a lot of negative outcomes. So things like feeling demoralized, feeling unmotivated or sort of stuck, feeling disengaged, frustrated, and even just a sense of feeling less effective at work. So this really makes it so important, especially in a time of crisis when people's social needs might be really threatened or triggered, to figure out how to serve those social needs so that people can stay engaged, feel motivated, feel connected, and feel effective. Especially because our response towards having those needs being threatened is especially strong in times of crisis. Okay, so I'm going to move us toward talking about a model which comes out of neuroscience. And the acronym SCARF is an easy way to remember this model. It's 5 social needs that all people have. And I'm going to walk through on the following slides what those are. This comes out of neuroscience research from the Neuro Leadership Institute. So I'm going to walk through each of these and provide work-related examples to help explain what each of the SCARF needs are, the acronym, what it stands for. But even though I just want to acknowledge, I'm going to provide some work-related examples and also ask you to reflect in chat what your examples might be for some of these things. But I want to just acknowledge that we have social needs in our personal lives as well. And there's so much going on in the world right now and in the political arena and in our personal lives that all of that impacts how we show up at work and how we feel at work as well. So even though I'm not going to provide some personal examples, know that those are real issues as well that do, of course, influence how people feel at work. Okay, so let's get started. The first social need that people have is status, a need for feeling seen, feeling respected, to feel like our contributions are meaningful and that we have value. So what people might be experiencing right now in terms of a threat to those needs are, what is my value to the institution? You know, does our lab still contribute the same value as we had before the crisis? Are we still a meaningful part of the team in the same way that we were before? And similarly, as people's involvement in research may be shifting or the ability to even work together might be restricted, what's my value? What role am I playing, and how am I meaningfully contributing during this time of crisis? So those kinds of things might be coming up for people on your team. I'd ask for you, if you have examples, just to put those into chat. I'd be really interested to see how the issue of status might be coming up for you or your team in your own experience. You know, this idea that people really need to feel valued and feel like their contributions are meaningful. Is that being challenged right now in the time of COVID or other crises that we've experienced recently? Yeah, so thank you for pointing that out, Julie, about status is important with regard to title. So certainly indicators of hierarchy and all of that can be indicative of status and can help either serve people's status needs or take away from that. So I just want to call out a couple things that might be showing up for you and give credit to Andy because he helped me think through some potential examples that might be relevant. But in the core labs, you support the researchers and their science, but your lab might not always get credit, as much credit as you deserve as part of the work that you do. And certainly COVID-19 is creating restrictions in terms of protocols and the ways that we can operate and work together. And so all of these things can lead to a sense of questioning or a need to really further define and feel one's value right now. Yeah, I see furloughs as well. Definitely, if I'm being furloughed, what is my value now? And does that reflect on my value? So a couple things that leaders can do in response to a need for status are really rallying people around a mission and giving people a role and a purpose. We talked about that before. That is something that really serves people's status needs because they feel like their work is directly connected to the mission and that has meaning. So the more a leader can actually create those connections and call those out explicitly, that serves the need for status. A couple other things, and I have this captured at the end in a kind of a one slide that captures all these tactics. But other things are giving meaningful praise and recognition, calling out the importance of the work, including people on decisions. There's nothing that signals someone's status more than asking for their input or allowing them to have a part of a decision, an important decision, sharing information, and then diminishing the sense of hierarchy when talking about people's values and contributions to the team. So that's sort of, I think, what Julie was getting at too, is, as much as you can, making sure that people, regardless of what their title is, feel like their work is valuable and meaningful to the team. So that's the first social need. And I should say, all people have needs for all of these things that I'm going to walk through today. Certain people have greater needs in one than the other, but all of these things are things that all people need. So everyone's going to have a need for status, certainty, autonomy, relatedness, and fairness, but may give more weight to one or the other. Okay, the next social need that leaders should be aware of is the need for certainty. So this may come to no surprise, especially right now. There's a lot of uncertainty with so much right now. And our brains really like to know what's going to happen. We really crave certainty. And right now, there's a lot that's very dynamic and in undecided or uncertain, and that can be very difficult, especially for people who have a very, very high need for certainty. So for example, with COVID numbers rising, your labs might be shut down very quickly or restricted very quickly. There might be questions around job security, like the example around furloughs. And I'd be interested to hear in the chat, what are some things that you are seeing coming up for your teams around a need for certainty? What challenges are you seeing with people struggling with the need for certainty? Feel free to type that in chat if you have thoughts around that. Certainly, you might experience uncertainty around how to keep your lab staffed up if people are taking time away for personal reasons or because they're ill or for other needs. So lots of uncertainty around so many things right now can be really difficult for people to deal with. Yeah, expectations for having people be in the lab but not having routine testing available. So how am I supposed to come into work and be safe and not have access to testing? That's a great example. Thank you, Julie. So what can leaders do to help with certainty in a time that's so certain and there's lots that's out of our hands? One is take decisive action when you can, so that people at least know what the plan is. And that goes hand in hand with the ideas around sharing information in a timely way and being really transparent, so that people know as much as they can possibly know in a time that there is so much that is uncertain. Also, as a leader, be available. Don't be isolated, but be available to people and give time to answering questions. Have people know when and where they should be able to get their questions answered. I'll give one example. At OHSU, we have a daily email that goes out from our chief of staff, and that has really been a great place for people to know where they can get all of the high-level information about what's going on in the hospital with PPE, with big issues that the institution is grappling with, and also other things like shout-outs and recognition. So people know that they can get their information in that daily email, and that takes away some uncertainty, obviously not all. But those are some things that you can do to help with uncertainty on your teams. Another social need that we experience is the need for autonomy. People like to be able to exert control and make choices related to their own environment and their work, and to feel like they are able to have a meaningful impact in the decisions around their work. Even just the perception of autonomy can have a really great ability to help us cope. So this can be threatened in many ways, right? So your lab might have little control over restrictions, new protocols that you have to follow due to COVID-19. You might feel like your department or your users or your administration has greater influence over choices or decisions that are happening in the lab. There's a lot that might feel out of your control right now. And there is a need for people to feel a sense of autonomy. There's a real need for that. And that might be challenged in unique ways during crises. So I encourage you to type in the chat if there's any examples that you can think of how autonomy, the need for autonomy, is being challenged right now for you or for your team. I know at OHSU, one example around this is that people whose work was curtailed or who were not able to continue doing their regular work have been asked to do other kinds of work that's maybe outside of their normal role scope, and that can lead people to feel like there's a loss of autonomy, a lack of choice in what you're doing and how you're doing it, and that can be really challenging for people to deal with. So there's a few things that leaders can do in times like these where people are feeling stretched and not having a lot of control. One is to avoid micromanaging. So as new protocols go into place and new operational approaches have to be in place due to COVID, for example, it can be really easy to sort of micromanage that because it's new and it's stressful. And that kind of support is, of course, necessary and useful, but just be thoughtful about how much support and how many check-ins are necessary, and allow people some space to do their work, to have some autonomy, to make some decisions, and just be mindful of that need for autonomy. Also, in a time when we feel so out of control, narrow down on what you can control and call that out. Hey, you know what? A lot of this feels out of our control right now. Here's what we have control over. What do you want to do, right? And empower your team to make those decisions, even if the scope of those decisions feels narrow. Call out what they can control and give as many decisions and empower your team as much as possible in that scope. Let's see, the time working from home allowed for freedom to, yeah, absolutely. So Dennis, thanks for that comment. Working from home might allow for more autonomy and freedom to select learning opportunities and things like that. All of that is really important. And Julie, I appreciate your comment too about, there are people who really want a lot of hands-on support and some who prefer to have more autonomy. So even being mindful of the unique needs that people have can be really important. Okay, I'm going to move on, and thank you. I see this also the call out for letting people make their own schedules, and that's a great way to provide autonomy. Another social need that people have is the need for relatedness or social connectedness and a sense of belonging. And this can be especially threatened or triggered if there's an in-group and an out-group that develop and people feel like they are not part of the in-group. That can really trigger people's needs for relatedness or make them feel like that is being threatened. And during crisis, people really crave a feeling of connection. So this is something to think about really carefully about how are people experiencing this on your team, the need to feel connected and a sense of belonging. Certainly, I've heard at OHSU a lot, people are restricted, and even in terms of being able to enjoy some of the small connections that used to make work really enjoyable, like having a coffee with your colleague on a break or having a casual conversation or a walk. Those things are just not possible with social distancing and being masked all the time. And so we can be missing some of that, right? And a lot of people working from home or maybe having to be on different schedules to reduce capacity in the labs. All of those things can impact our ability and our to really connect right now. And in addition, with all of the stress that we're experiencing, sometimes it can be difficult. People are stressed, they're burned out, and that can get in the way of us sometimes having those good, positive interpersonal relationships because people are stressed and either aren't making time for those connections or just aren't capable of having those positive connections right now due to the stress that they're under. So how to serve this need in times of crisis. There's a couple things that I would say. One is really do prioritize and make sure it's known that it is part of work to establish and make time for those connections, right? I hear from people, well, gosh, it's hard, we're so busy, it feels sort of superfluous or, not important to make time for a 20-minute even a virtual chat with a colleague. But those are the things that keep us connected, keep us motivated, keep us going, and really help us to do our work effectively. So schedule a coffee chat, virtually even, with a colleague. Make time for fun activities with the team, even if it's just in virtual meetings. It doesn't replace face-to-face, but it can help people to feel connected. And then as a leader, make sure you're available. Have time for the one-on-one conversations, check-ins, and be generally available to your team. That can help people to really feel connected. And then also be vulnerable. As a leader, the more you can show, hey, I'm feeling some of this stress too, it opens up the conversation. It validates what people are dealing with and can help people to feel connected interpersonally. It's not just work, work, work all the time, but you can talk about things that you're dealing with and to be open about that. I'm seeing some great comments in the chat, and I really appreciate that. Increasing the frequency of staff meetings so that people can know when they're going to get together and connect and not feel isolated. That's great. Using Microsoft Teams is awesome. We've been doing that at OHSU as well, and that's been really helpful. One final thought about relatedness: if you know that there is the tendency for sort of in-group and out-group relationships or groups in your lab, be mindful of that. That can really get in the way of people feeling connected and feeling a sense of belonging. So whatever you can do as a leader to create a sense of inclusiveness and to break down the boundaries or the barriers between the in-group, perceived in-group and out-group, the more people will be able to have that relatedness need met. Okay, and then finally, fairness is a need that we experience. We feel like we want things to be fair, we want things to be equitable, and specifically we'll look for the processes and procedures, especially around important decisions or resource allocation. We want that to be fair and transparent. And a lack of fairness can be very triggering for people. There's a lot of people for whom fairness needs are very, very high. And without that, or when those things are threatened, when they feel like things are inequitable or unfair, that can really break down trust and collaboration and be really challenging. So this might come up in a lot of ways. For example, funding cuts or budget cuts, furloughs, or other things that may be applied. At OHSU, I know we had different types of cuts for different groups, and that created a sense of unfairness and questions. Someone I think also called out about working from home, and it also can be really challenging if some people are able to work from home, but then others are expected to be on site doing the work and might feel like that's an unfair burden due to COVID-19 risk or something like that. Yeah, so Andy, thank you for pointing that out. Frontline staff are having to come in more often, having more risk to exposure to the virus, whereas leadership and maybe others are able to work from home, and that can create a real sense of unfairness and disparity. Even if it's being done for safety reasons, right? That doesn't always take away the sense of like, that's just not fair. There might be a reason for it, but it feels really unfair. So thank you for pointing that out. So what can you do about this as a leader? Because often you don't have control over all of the decisions that are leading to a sense of unfairness. I think there's a couple things that people can do. One is leaders can be as transparent as they possibly can be about the things that are happening. So transparency can go a long way. Also, whatever is in your control as a leader, create and stick to clear processes for making decisions and allocating resources. Whatever is in your scope, make sure that that is as fair as possible, knowing that some of the things that are happening in the organization or elsewhere, you might not have control over influencing the perceived fairness of those decisions. Always explain the why behind decisions and give people a chance to ask questions and respond and have a conversation about that. And then also in your own decision making, just evaluate the fairness of your process and look for bias. Is there any bias in your own decision making? And are there ways to address some of those things? So those are a couple things that can be used to address fairness. So I know we've walked through this quickly, and there's a lot here, but I'm curious, and this is where we'll do a little poll. I'm curious to know which of these 5 needs, the need for status, certainty, autonomy, relatedness, or fairness, which of these do you think is most challenged for your team right now, or is being sort of most threatened for your team right now? I'll give you just a minute to fill that out, and we'll see what comes up as the greatest need. And I'm not sure how much time we have allocated to the poll, but maybe 10 more seconds. We'll make it a quick one.
Okay, can we post the poll
Great.
results? Excellent.
Okay, so perhaps not surprisingly, certainty came through as the strong lead here. There's so much going on that's uncertain right now. That doesn't surprise me. And I think in any time of crisis, certainty is going to be a big one. But pretty interesting that relatedness is also a big issue, the feeling of connection and belonging. So would love to hear a little bit more about that in the Q&A time, and you know, if there's any questions or ideas that people have to offer, it would be awesome to hear some of that about some of these issues. Okay, I'm going to close the poll, and I just have one more slide, and that is basically just to reinforce how to use this model for your team. Be aware of your own SCARF triggers. You know, what are your personal needs around status, certainty, autonomy, relatedness, and fairness? When you're feeling triggered or feeling like a certain response towards certain situations, reflect back. Are my needs being met? Why am I feeling about this situation the way that I am, or responding in the way that I am? And is it because potentially one of my needs is not being met? So just even be aware of your own needs and how those are being met, and how maybe when those are threatened, it sort of leads you to act in certain ways or feel certain ways. And then also think about your team members. If you see them responding in certain ways, or reacting or behaving or communicating in certain ways, think about the possibility that those behaviors or communication might be because they are not having, you know, it linked to, I should say, their social needs. And it's possible that some of those social needs need to be better served. And there might be ways that you or the team could think about how to better serve those needs. And then if you identify a need, think about what are the specific behaviors or actions you could take, either to serve your own needs or your team's, to really better serve the social needs that people are feeling threatened right now. And then this last bullet point seems like a throwaway, but it's really important. Call it out. Be very explicit about it. So for example, the issue of certainty, talk about it. Hey, things are super uncertain right now. Let's just acknowledge how bad that feels, or how difficult that is. Let's think of what we can do to get our arms around what we know, and how we're going to share what we know, so that we can at least be clear on what we're certain about, and what we're not. And so the more you can even just talk about that will help sort of assuage some of the triggers around not having those needs met. So, and thank you, Julie pointed out, you know, the key challenge for her teams changed at various times over the last 8 months. And I think that's going to be true of many teams, right? You'll go in kind of waves where you really feel like a need for connection is your strongest need. And then maybe it's a need for fairness because something comes up. So thank you for pointing that out. It's not always going to be just one thing, and it might be multiple things at the same time. With that, I'm going to conclude, and I'll just leave this slide up. It sort of captures some of the key steps that you might take to serve some of the social needs that your team is experiencing. So I'll just leave that up if it's helpful to have those sort of captured on a slide together, but would be happy to open it up to comments, questions, feedback.
Yeah, everyone, feel free to jump in. I noticed that Anoja mentioned something that I think is really true. At least I feel it is that, you know, while I have the freedom to run out in the middle of the day and get some groceries or something like that, the lines between work and home life have blurred so much that I also find myself at 11 o'clock at night, you know, going over some things when normally I would have carved out some time for home life at that, you know, specific period. So I'm sure we're all experiencing that, and would just love to have people join in the conversation. If you would like to share some of, feel free to unmute when you're talking and share some of your experiences or ask questions.
So this is Dennis Koop from OHSU. Is this thing working?
Yes.
I'm trying a new microphone. I didn't think my camera was going to be on, so I'm not going to show that. But I'd like to hear thoughts from other people on how do they deal, and it probably has to do with both status and certainty, how core directors are dealing with PI pressure. You know, labs were open, they got more crowded, they got busier, and a lot of their work gets bottlenecked in a core. And that's because, I think it's great because it shows how important the core facilities are. But as a contrast to that, what it's done is it's put a ton of pressure from big PIs. I mean, you know, we're talking about the guys who are Hughes and, you know, the big dollar guys that are saying, look, we need our people, we need these samples running, we need our people trained, we need X, Y, and Z. And as a core director, you're just kind of stuck because your people are afraid. And so how are people dealing with that? You know, trying to have staff have autonomy, make decisions, you know, express their fear of being exposed. And especially even though, in my belief, we should, as a medical facility, have testing available, it's not. You know, it's not regularly available for the people who aren't showing symptoms to be tested to say, yes, I'm free of COVID, I can be trained. You know, that kind of thing would simplify. But, you know, how are core directors dealing with that? Is there something that, you know, as a general rule they're finding, or is this just unique to OHSU?
Anybody want to jump in and give some insights onto that?
Jeff
I can
Weiss from
say a little
Northwestern.
bit.
Go ahead.
So
Go
I
ahead,
can
and
say
then
a little
Jeff.
bit about how this was handled at Stowers, at least when we first opened up. One of the things that the Institute did was just put a limit on PI budgets. And that was really helpful because PIs didn't have money to spend on projects. I think more than anything, the message has to come from the top. The core facilities, we are able to set certain guidelines, timelines, and all that, but we need the backing from the management.
Jeff?
Yeah, so at Northwestern, we ran through this in the beginning when everything shut down hard, but I think everybody realized that the course didn't have much control. And so we actually just had a completely top down. You had to be approved to go to a core facility at all by the dean's office. And that sort of took the core directors out of the mix. But what I've heard, I just wanted to say, we've heard a lot recently from core directors who are concerned that with the surge, they're going to have to go into a second restriction and a second lockdown. And they're very worried about how they're going to handle the investigators at that point, because they're going to have to start turning people away as the capacity winds down. We don't have an answer for this, but it's definitely something that's a widespread concern, not restricted to OSHU.
I think I can speak a little bit for, you know, OHSU to Dennis's point. You know, not every institution has a structure like ours, but certainly I'm in the position as the director of University Shared Resources, whereby I'm available to core directors who are feeling pressure to do things that they are not comfortable with. And our chief research officer is fully behind any core director that does makes decisions around the safety of their staff and what they can and cannot do or do not feel comfortable with. So I can provide, as the administrator, some sort of cover for those core directors and even reach out to the individual PIs if necessary to talk about it. And that speaks to Anoja's point that there has to be something, or it's very helpful to have somebody who can provide you that kind of cover. Whether it's the VP of research or whether it's someone like myself, who's the director of the Shared Resources Program. I'm seeing a lot of comments coming in. Andrew Vennard mentioning that leadership supporting the cores as autonomous operations is helpful. Delegating the responsibility to chairs and institute directors. So Claudius, I have a quick question about that. Does that ever translate into, say, some of the decisions being made, perhaps without uniformity across, and does that cause problems at all without having a centralized statement about that?
So we do have a centralized ultimate decision making, but we realize that most of these decisions will be, if done away from the place where they are needed, they will lack context because of the issues of work balance. So someone has to be really in the mix to know exactly what's happening in the core. So having it delegated to the chairs, they speak close, they are very close to the cause. It makes faster decision making, and we have more turnaround in terms of what needs to be done. And so by moving it directly to the chairs to make the decisions, it shifted the responsibilities of the overbearing, those big PIs. They need to communicate also through the chair for most of the issues that arise in the cause. So that's why we decided to decentralize it for quick communication, contextual. The decisions are made in context because they know exactly what's going on at the core level.
Great. So it's an easier way to get communication out, it seems like. Actually, Katie, you mentioned something about work-life balance. The Harvard Business Review had a special issue about it. If you are willing to share it with me, I'd be happy to have it posted on the ABRF site so people can check into it as well.
Sure. I think it's just available on the internet.
Yeah. Okay.
I'd be happy to provide the link, but yeah, it's I do another training at OHSU on remote work and how to work effectively and manage effectively in remote work environment, and draw a lot on the model around thinking about how to manage the work-life boundary, and setting boundaries to prevent burnout and overwork and all of the things that were called out in the chat is really important. It's hard to do, but it's really helpful.
I think Julie had a question.
I was just going to say, I think that there's, in response to Dennis's original question, there's really a difference between how a core director might respond to his question and how an administrator would respond to his question. And I think those of us that are in administrative positions like to think that we are supporting the cores and do have their backs all the time, but we may not be communicating that appropriately if the core directors don't feel that that's necessarily the case. And that might indicate a point where more communication is necessary. I also think that, in response to the approach that Claudius mentioned, I've had actually pushback from department chairs who have been advocating on behalf of their researchers that some of the protocols that we put in place are a little bit over the top or a little stringent, or maybe we could ease this. And when discussing with the core directors, I take those immediately back to the core directors and say, what do you think about this? If you don't want to do this, if you think this is not appropriate, we will not do it. I will have your back and I will respond appropriately. And then I have the conversation with the BCR that says, this is how we're responding. And you told me you would have our back, so you better have our back on this. And if he disagrees, you know, he would let me know. But I think sometimes that is where the pressure comes from too, where department chairs come in and say, you know, I just need you to bend the rules a little bit here. And that impacts on the autonomy of the corps in making decisions around their own appropriate SOPs for their disciplines and their laboratories. It erodes trust, and it really impacts on the certainty piece of the SCARF too, because then people in the corps don't really know what to expect anymore. They don't know if people are going to have their backs or not. And so I think it's a really good point that Dennis brought up, and just wanted to point out that, you know, administrators hear that question differently than the corps directors hear that question, and the responses.
Hey, Julie, can I ask you who made the baseline guidelines, or possibly even more importantly, who was perceived to have made those base guidelines? And the reason I ask is because one of the things that Purdue did was radiological and environmental management created the baseline guidelines. Like, you cannot be more lenient than this, and every PI and every lab member knew it. So it was good because we were always able to refer back to a higher central authority and say, sorry, REM says this. That is not open for debate. And I'm wondering, our corps had autonomy to go stricter if they felt that wasn't enough, but they were already pretty strict to begin with. So I'm wondering if that, is that how other people did it? Did it come just like from corps and centers or directors? Where did those guidelines originate for you guys?
Yeah, the original guidelines came from the BCR convened a research ramp up / down task force. And it included representation from each of the scientifically intensive colleges and 2 professional schools at Davis, as well as representation from the core facilities and from environmental health and safety and other areas on campus. And those guidelines were developed in collaboration with our county health officials, actually, that said, this is how UC Davis will continue to operate as an essential business within Yolo County, right? So that was the baseline. The corps then, we convened the corps immediately and said, you need to develop your own SOPs if you are comfortable with doing any work at all. Some work will continue. It has to continue to maintain very essential capabilities. And that's what the BCR defined initially in the original guidance that he published in March. And that was, things that impacted on animals, health and safety, we're a very large agricultural institution. So we have a lot of plant based research that had to continue, or, if plants die, that's a problem. A year's worth of research goes down the tube. So there were a number of things that had to continue, and those corps that had to support them developed their SOPs on top of those guidelines. But they had the autonomy to develop the guidelines that they felt and the SOPs that they felt were best for them, or they could choose to be closed completely. But it did start, Natasha, at the very top in the VCR with a very dedicated work group.
I would add that at our institute, which is a privately funded academic institute, which is much smaller than what Julie is part of, it's kind of the same. There was an executive group that met very regularly with the environmental health group, and they set the guidelines. We went from a complete shutdown to gradually opening up the institute. And we constantly had conversations with our COO, who the co-directors report to. But that executive group is the one that came up and said, okay, you guys have 20% capacity, work out what you can provide during this time. And then now we are at a higher capacity, but still the co-directors work on the specifics of how the teams are functioning. But the institute as a whole come up with higher level guidelines.
Right. We had something similar. We're fortunate that our VPR and the president of our university are both epidemiologists, so they really focused on this, and in the end, together with faculty and other stakeholders, developed a very detailed set of guidelines for the whole university. We took those guidelines and made additional specific guidelines for the shared resources, and then individual cores then provided more detailed guidelines that were specific to the instruments and production pipelines inside their own cores. Sean Williams put a note in saying that there's, he's finding that there's a need to remind folks about what these guidelines are over time. I would agree with him. I think, we've had the occasion where we had to not only remind investigators, but refer them to the office of the VPR so that they knew what they had to actually do, not just in terms of the guidelines for using the cores, but the guidelines that they had in terms of running operations in their own labs. So that's always a continuing type of challenge.
Yeah, and to address that particular issue, my awesome lab manager put on our internal website all kinds of guidelines in really like bold red letters. So if anybody ever came back and questioned something, she will just point the person to that.
So we have about 1 minute left. I think this has been a very, very helpful presentation, and I want to thank Katie so much for putting so much thought into this. I believe a lot of people found it very useful. I think one of the things, we're all leaders and we're all thinking about our staff in these respects, but also think about yourself going forward. How your SCARF needs are being met, and if they're not being met, then maybe we can discuss in future discussions about how we can make that happen. Sometimes that gets lost a little bit in the leadership role, and but again, I just want to say how much I appreciate everybody joining in the conversation, and once again, Katie, thank you so much. It's been a wonderful presentation.
It was my pleasure. Thank you so much for everyone for engaging in the conversation today. It was great to be a part of your group for the day.
You might be asked back at some point.
Great. Would love to.
All right, people. Thanks. Stay safe out there, and have a good rest of the week.
Bye, everyone. Thank you.